everyone, and welcome to the launch of the CXIO network.
The whole reason that the ADHA is supporting a network for clinical leaders is that we're going through a huge change in healthcare with digital technologies coming in and transformation of the whole industry. And moving from analogue to digital is a huge change. And we're seeing a rise of these new roles where senior clinical leaders are needing to interface with the business and IT to ensure that the clinical workflows are supported and enabled, not disrupted.
I think the role of a CXIO is really important these days as health IT starts to emerge as a mainstream issue in all aspects of healthcare. We need true leaders that can actually provide stewardship for the design, delivery, testing, implementation and the actual leveraging of systems.
And the other thing that we find as well is that a lot of people, like you said, they've been doing the job informally, and it just surprises me how many people, they don't have the CCIO or CXIO job title, but they're expected to do the work on top of everything else without the necessary professional recognition about what that role is about as well, which is challenging.
I mean, I see it very much as a support network. I think if you look at things like this and like the HISA, they're different vehicles to increase people's knowledge, to give them a community to learn from.
We know that digital health is really hard. It's a massive change exercise. We know that people, or clinicians and hospital staff, community, the issues that people face when they're implementing digital health or clinical information systems are relatively similar across the board. And you really need clinical leadership in order to help sort of drive that change.
Well, we've been talking about it for so long that, investing in people is so important if you want to get the outcomes. And so the fact that the Australian government, through the agency, has invested in creating this network, really investing in the clinical workforce, the clinical leaders of the future as well as the now, is fantastic.
Being able to bring all of that together, and I think you make a really good point about there being pockets everywhere. There's great work going on, but imagine the power that can be leveraged from that network actually coming together.
I think one of the big benefits is that sense of community and that sense of sharing. So already there's been activity online under the banner of the network. Good example is some conversation recently about the impact of load on people's thinkings in the clinical context.
It's important to have the clinicians involved in this transformation. I mean, historically a number of IT projects have been done without enough clinical engagement. And when I say clinical, I don't mean just nursing and medical, but also allied health, pharmacy, dentistry, and across different domains as well, so that we ensure that the disruption that comes with implementation, particularly of large IT systems, is minimised.
The real benefits for the clinicians and the community is that we are helping to modernise healthcare. I think it's really important is that the college and HISA came together with the agency to do this in a partnership approach. So people will know that wherever they come to the network, it's really a whole partnership.
So I'd strongly encourage anybody who's interested in the network, who's in one of these senior roles, who's on a trajectory to being one of these senior roles, to actually look at joining the network. I think it's a great opportunity.
So even if you're a little interested, have a lot of information, if you're someone who's been doing it for a long time, this is the one opportunity to talk to your peers and really transform healthcare. Let's do it together, let's do it for our patients, let's do it for our community.
If you're a clinician with a desire to get involved with shaping the future of clinical informatics in Australia, then I really urge you to join us and help us transform healthcare.
This is a tremendous and really exciting opportunity to be part of a digital health tribe.
So look, if you're already watching this video, you've learned how cool the CXIO network is, and why aren't you already online and joining? So just do it.